Good afternoon to one and all. I, Miss Rucha Bade, welcome you all on this International Breastfeeding Week celebration 2023. Today is third day of Breastfeeding Week celebration. It's a great pleasure for me to introduce our international speaker, Mrs. Pranalini Pardeshi ma'am. Ma'am has qualified with masters in child health pediatric nursing. She has done additional courses in cognitive behavioral therapy in palliative care and neonatal resuscitation program provider course and training of trainers. Ma'am has experience of total 17 years in teaching and 6 years in clinical experience. Currently working as a lecturer practitioner in Anglia Ruskin University School of Nursing and Midwifery, Cambridge. Ma'am is passionate for nursing since 23 years in various capacities, excellent communication skills, can work efficiently under the pressure, taking initiative. Ma'am has life membership with United Kingdom, that is Trained Diabetes United Kingdom and United Kingdom societies. In India with TNI and Indian Association of Nurses registration. Ma'am is going to speak on empowering breastfeeding parents' perspective. Over to you, ma'am.
Good afternoon, and welcome to this webinar on empowering breastfeeding parents' perspective. I take this opportunity to thank Bhagyashree Madam, Sujita, my dearest friend Supriya Pottal, and the organizers of this international webinar for inviting me as a resource person. So let's see what is meant by empowerment first. As per the Oxford Dictionary, empowerment is the process of being stronger and more confident, especially in controlling one's life and claiming one's rights. According to the World Health Organization, empowerment is a process through which people gain greater control over decisions and actions affecting their health. So, in other words, empowerment is enabling people to take informed decisions. So, in today's session, I'm going to highlight on some of the research findings regarding parents' perspective towards breastfeeding. And then I'll go on to discuss about the key constituents towards empowering breastfeeding. So, my webinar is about research findings regarding parents' perspective towards breastfeeding, factors affecting parents' perspective towards breastfeeding, and then the key constituents towards empowering breastfeeding parents' point of view. So, the parents' perspective. I have divided this into four categories. That is, their perspective towards breastfeeding corresponding to themselves, their baby, their partner or their relationship, and the society. So let's see now what is the mother's perspective towards breastfeeding regarding herself. So most of the mothers they felt that breastfeeding is beneficial for their health because it researchers have proved and they were aware of the researchers that showed that breastfeeding reduces the risk of cardiovascular diseases or type 2 diabetes and breast and ovarian cancer. They also felt that breastfeeding is quite easy and convenient. Some of the mothers felt or perceived that the breast size determines the capability to breastfeed. So they thought that bigger the breast, it is more easier and better for the to breastfeed. Some of the mothers they thought that or they perceived that breastfeeding develops helped them to develop a special relationship with their child. It also provides as a booster for the mother's sense of self. Some have reported that the inability to breastfeed may trigger or have triggered feelings of personal failure. Now, about the fathers. So, the fathers felt or they perceived that breastfeeding reduces their self efficacy. That is, the fathers reported the inability to feed their child independently led to feelings of inadequacy, incompetency, and low self efficacies as fathers. So, in short, they felt that as if they have no role in their in their child's nutrition. They've had a feeling of being left out, and some of them also perceived to have jealousy or envy over the mother infant bond. Next is parents' perspective corresponding to their baby. Let's see what the mothers perceived. Mothers perceived that breastfeeding was beneficial for their baby. They felt that they perceived that it was nutritious, it was healthy for their baby, and they also perceived that it provided protection from diseases and reduced risk of death from infectious diseases. It decreased the number of hospitalization due to diarrhea. It accounted for fewer respiratory and ear infections and also reduced the risk of sudden infant death syndrome. Not just that, but it also encouraged the mother and child bonding. The father's perspective corresponding to their baby were they also felt or they also perceived that breastfeeding is beneficial for the baby. However, some of them they felt that it acted as an hindrance that delayed or affected the creation of the bond between the father and the child. Now let's see the parent's perspective corresponding to their spouse or partner or the relationship as a whole. Regarding the mother, most of the mothers perceived that breastfeeding does not have a negative effect on marital relationship. Some mothers, however, perceived that breastfeeding will make them less likable in their partner's eyes because it will change their body. Fathers, on the other hand, found that breastfeeding might lead to an emotional rift and decreased intimacy with partners. Some of the fathers perceived breastfeeding brought them closer to their partners. Some group of fathers thought that breastfeeding was beneficial to their relationship as it allowed them to work through challenges together. So they felt that it was more of a teamwork which helped strengthen their relationship. Few fathers did perceive that breastfeeding as a process that negatively impacted a woman's body shape. Next is the parent's perspective corresponding to the society. Mothers perceive that they are under the cultural pressure to breastfeed their infant, and that breastfeeding is a sign of being a good mother. Some mothers, on the other hand, reported that they were pressurized by their family members or friends not to breastfeed. Some also perceived the public reaction to bare breast was being negative. The feeling the feeling of disapproval or disgust of others when breastfeeding in public was perceived by some. And some felt or perceived that those around them felt uncomfortable when they were breastfeeding in public. Let's see what the fathers had to say. Some fathers reported that they perceived public breastfeeding as embarrassing. On the other hand, some fathers perceived that breastfeeding in public might offend others. Some were concerned that their partner may receive unpleasant comments from onlookers. Some fathers perceived that mothers were crossing the line between immodesty and decency when breastfeeding in public. Let's have a general look at the father's perspective. Most of them felt that the ultimate decision to breastfeed should reside with their partner. They also perceived breastfeeding to be more convenient. Many of them perceived that breastfeeding was the right thing to do. Some of the fathers perceived breastfeeding to be challenging and a burdensome task for their breastfeeding partners, and that it was taking an emotional and physical toll on their partners. Most of the fathers perceived that their role was more about supporting whatever decision the mother made, irrespective of their own views. Factors affecting parents' perspective. Past experiences. Positive or negative past experiences definitely affected parents' perspective towards breastfeeding. The worry about milk supply. Most of the parents were worried whether the baby was receiving enough milk, as they couldn't see or gauge how much milk the baby is drinking. Social support and influence. If the parents had seen somebody in the family or in their friend circle who shared or who had a positive experience regarding breastfeeding, that impacted positively and and helped the parents to develop a positive perspective towards breastfeeding. Problem with latching on, that sometimes that did affect the parents perspective. If the child had problem latching on, then that sometimes deterred the mother from breastfeeding. Information about breastfeeding and support to make informed decisions. Practical assistance to breastfeeding partners. Most of the mothers, they felt quite supported if when their partners took on household chores or helped them with household activities while they were breastfeeding. Providing emotional support and advice of healthcare workers. So emotional support and advice from the healthcare workers positively affected parents' perspective. So that brings us to the last section of my topic, that is empowering parents. Family friendly policies. They are particularly important for working parents. Mothers need enough time off from work to recover from birth and get breastfeeding off to a successful start. Paid maternity and paternity leave. Paid paternity leave allows fathers to bond with their babies and promotes gender equality, including through the sharing of childbearing and household responsibilities without being worried about their finances. When it is time to return to work, flexible workplaces can support new moms and dads to meet their work and family needs. When a breastfeeding mother returns to work, time, space, and support are crucial to help her keep breastfeeding going when they return to work. Time, time to breastfeed and express breast milk during their workday. Space, space that is hygienic, comfortable, and private to breastfeed or express breast milk and storing it as well. And support from employers and workmates. Affordable childcare at or near their workplace. Provide employees access to meet the lactation consultant. Training of managers and employees to understand policies, set expectations, and be respectful of their colleagues' schedules. Providing enough education or knowledge and skill for breastfeeding right from the antenatal period. Mothers should be taught about knowledge and skills to prevent and solve breastfeeding problems that will lead to their self efficacy in solving breastfeeding problems. Fathers and partners can be taught about breastfeeding so that they can provide emotional support, share tasks around the house, and care for their partner and baby. This helps sow the seed of strong relationships and dads being more involved in parenting. Sharing the load also helps to support breastfeeding. Assurance about infants' proper growth and health. So this really is quite empowering for the mothers when they know that they are or when they are assured that that their infant is growing in the proper way, and positive feedback from healthcare professionals and families. With all these factors, definitely, if they are utilized in the right way and at the right time, it will definitely make the parents feel more empowered regarding breastfeeding. Here is a list of references and resources that I have used for my presentation. That was all about empowering breastfeeding parents' perspective. Thank you for listening and all the best.
Now, I would like to invite our next speaker, Dr. Supriya Pottal. Ma'am has qualified PhD in obstetric and gynecological nursing. She has done additional courses in education leadership, economics and healthcare sciences, certified course through NPTEL. Ma'am has total 16-year experience in nursing education, currently working as an assistant professor in Bharati Vidyapeeth deemed to be University College of Nursing Pune. She has done 29 research publications. Ma'am has done research guide for UG, PG and PhD thesis, co-investigator for ICMR project, coordinator for IQAC, elected as a alumni secretary for the period of 3 years, research cell member of Bharati Vidyapeeth College of Nursing Pune, recognized as a PhD guide, evaluated the minor research project for other universities and 2 books are published. Ma'am is awarded by gold medalist for masters appreciation certificate from Rotary Club of Pune East, master trainer for GFATM, IMNCI and NRP, research person at various international, national and state level conference. Ma'am has life membership with TNAI, Nursing Research Society of India, Indian Association of Neonatal Nurses, Society of Midwives, India. Ma'am is going to throw some lights on empowering breastfeeding, parents' perspective, role of support system. Over to you, ma'am.
Greetings to you all from Bharati Vidyapeeth deemed to be University College of Nursing, Pune. And we would be discussing something about the role of support system into breastfeeding. We are all aware that breastfeeding, as it is important for the mother and the baby, but then the support what the mother would get to initiate, to sustain, and to continue breastfeeding, it is of prime importance. When you talk about support system, it not only includes the immediate soulmate of the mother, that is the husband, but it would be the extended family, it would be the parents, it could be her mother, her mother-in-law, her sisters, and everybody who's involved in rearing of the child. So our Indian concepts always talk about family bonding. Breastfeeding, one of the most important aspects of breastfeeding, or one of the advantages of the breastfeeding, is to have the bonding between the mother and the baby. To enhance this bonding more, we should be aware that the support system, or we must support to empower the woman during breastfeeding. Support which the woman would receive, or which she should receive from the family partner and the people around, it is more important to continue the process of breastfeeding. Therefore, it is necessary for the healthcare team members to not only educate the mother only regarding the advantages of breastfeeding or what kind of dietary pattern she needs to follow, but also the kind of support which she would want to garner from her extended family members. Not only limiting it to the family members, the support system would also include for women who are at home or homemakers, or women who are working and who would want to join back work. So the support system which she would get from her settings, her social settings, her social gatherings, while traveling, while being with others into a public space. So all these things would really matter when you would say that you want to strengthen the capacity of the woman in order to breastfeed. And that is why, as healthcare providers, or as members of the health team, we need to know regarding the support system, which is a global phenomena now, and what the global settings or what countries abroad have to say regarding the support system. So there are a few researchers which have been documented, uh, and in Vietnam, a study was done and which showed that there are increase in the breastfeeding enhancement, which has improved by engaging fathers. And how do we engage the fathers? Or to put it correctly, it would be the partners, the women and their partners. So you need to counsel them, you need to have an educational material, you need to counsel at the community settings. As community health nurses, when we go for home visiting, it becomes equally important for us to tell them or to make them aware that yes, the mother is breastfeeding, but the importance of the role of a father, or to be there along with her, it becomes very, very important. So when we talk about early breastfeeding, initiation, exclusive breastfeeding, uh, the amount and the support of family, it becomes twofold over here, because as the baby starts growing, the baby's demands increase, the time of the mother rearing for the child increases, and this is the time more where she would require the kind of psychological importance, what she or psychological support, and then importance of the family members to be with her. There was a study which was conducted in China, and again, on how the fathers would be helpful, or how the fathers could help to support the breastfeeding, and it has proven to show the results, which says that there was an increase from 26% to 51% at 4 months, and from 18% to 40% at 6 months. So, as I just mentioned, that as the child grows, or as she rears the child, the demands of the child increase, the child's activity increases, motor activity increases, and it is required that the child's growth and development has to be optimal. So inclusion of the fathers into this process becomes important. Similar study which was conducted as a trial study in a Turkish country, which says that it increased from 33% to 56%. Again, Indonesia, where the fathers, grandmothers, community leaders, they were included in the process of breastfeeding to support the mother. It has shown an increase to sixfold from the current statistics which they had. We have a framework which has been developed as a result of a study, and this framework has been given by Jennifer Dick and Sydney Lee. And they developed this breastfeeding co-parenting framework, which talks about setting breastfeeding goals together. Second one is shared responsibility. Third one is mutual support, bonding between the baby and the family members, and good communication. Now, when you talk about setting breastfeeding goals together, now the education material which we give to the mother or to the family, or we have mothercraft classes where we encourage the family members to be supportive to the mother in the antenatal period itself. So in the antenatal period, you need to guide them, you need to tell them, you need to prepare the mother for breastfeeding in the last trimester. There have been mothers where we have seen, or literature proves, and there are researchers which have said that the breast starts preparing for breastfeeding, and only the initiation part or setting up part would start when she delivers the baby. So setting up the goals together, you require to involve the partners, the extended family members, that's the grandmothers or the mother, the mother-in-law, her sisters, whoever is there to support the mother during the childbirth process. Shared responsibility, again, it is equally distributed among the family members. Like as in, we tell the mother whenever the baby whenever she feeds the baby, she needs to know the signs of how she would understand that the baby is now full, the baby will leave the breast on its own, the baby would pass urine 8 to 10 times a day, and every 2 hours she has to feed the baby. So the baby has to gain weight, definitely. So these are certain things where not only the mother but even the extended family members have to be made to realize, and this we would do it by providing educational material to the mother and to her extended family members. So shared responsibilities here, again, it means that things which are required for the mother to initiate to sustain the breastfeeding, that also becomes important. Her financial support which she would need, because we know in India we have got a diverse area when it comes to the socioeconomic status of the mother. So unless and until the mother's nutrition level is maintained, only and only then she would sustain the breastfeeding. So the shared responsibilities doesn't only limit to the mother and to the baby, but additional responsibilities which includes psychological support, financial support, her health expenses, all that would be shared under this particular uh, area. Mutual support, not only from the family members, but it would also require support from the community, or from the people who look forward to. We generally have a concept that a breastfeeding mother would have got her own challenges, and her daily routine, her daily lifestyle would be affected, but not letting it being affected, helping her to have a normal growth and development, or helping her to have a normal lifestyle, that becomes the responsibility of the healthcare member, the team of the healthcare members, to make the extended family members realize this. So mutual support would be in the form of community participation, where if the mother is working, she's a working mother and she's a breastfeeding mother, she need to have those rules, regulations, policies which allow her to breastfeed her infant, or we need to have certain areas into the OPDs when the mother comes for her follow-up checkups. There should be areas in the public places. Nowadays, we know that we people for their daily needs, they go to the shopping malls, or they have to, they need to travel. So at such places we need to have specific centers which would talk about specific areas which talk about breastfeeding rooms or breastfeeding consultants, where all these issues could be solved. So mutual support is extended to the community participation as well. Bonding between the baby and the other family members. Breastfeeding establishes the bond between the mother and the baby, yes, but when the mother is equally supported, this kind of a bonding, it is extended to the other family members also. So encouraging the family members to help the mother to carry out all these practices would increase the bonding between the baby and the other family members as well. Good communication becomes very, very important, because information, education, communication sets the standard golden rule for encouraging any good health practices. So the education material which we provide to the mother and to the parents or to the couple, not limiting it to them but spreading it all over, would encourage each and everyone to help in the process of establishing breastfeeding. So under this framework, co-parenting becomes important. Now, co-parenting does not say, or it does not limit to the spouse or to the husband and wife only, but co-parenting has to be extended to the other family members also. In Canada, which also says that they have found certain literatures that uh, not all types of family members will be supportive and helpful. So knowledge on the part of the family members have to be given, and um, in this particular study, they said that they found breastfeeding rates were higher among mothers who reported that the fathers of the baby was not only knowledgeable but also present and responsive to their needs. So, as we've been discussing, when we have mothercraft classes, it is important that the father also accompanies the mother, and he knows regarding the kind of growth and development the child would go on, and the requirements of the child, and only then he would be responsive. He would feel the need, and he would feel the necessity to be with to be with the baby. So that is why under rules, regulations, and policies, we do have something for co-parenting. We do have something called as the leave which is given. As we have maternity leave, there has been a leave granted to the father as well, to enhance this process of bonding and to be supportive um, for the woman and for the spouse and the mother. The Cochrane Review analysis also shows one of the examples which were done is Pakistan. It shares that the partners and the family members are willing to learn about the supportive breastfeeding practices, and they need the kind of information, and they need the kind of they need to know the kind of services which would be helpful. And this definitely will help in impacting and promoting breastfeeding, and it will help to elevate the relationships between the family and the loved ones. So that is why it calls upon to say that there are many researchers. There is a need to do many researches which would encourage the family and would help in exclusive breastfeeding. Here is a model which has been put up, which says that it is a kind of a model which is derived based upon the King's theory of nursing, and which says that there is a dynamic interaction between the mother and the child. So, breastfeeding, to elevate the kind, it should not be perceived, or it should not be seen as a stressor or a stressing factor, but you need to keep into mind the woman's and the child's biological condition, the woman and the child's perception, and the woman's decision making. Now, for a woman to have decision making, it becomes important that she has to be supported. She has to know her own role, her mother's role. She need to have a space for breastfeeding. There should be organization of the system where the perceptions, whatever she has, promotion and support has to be taken from everybody she comes into contact with. She should also, the woman's body image has to be kept in mind, and then she would have family and social authority in implementing the kind of physiology which has changed, and the physiological needs of the baby have to be met. So this dynamic interaction between the mother and the child, this is as a result of the King's theory, which has been uh, come up with a research. To conclude, I would say that the breastfeeding interactive model, it is based upon the different social, cultural, political context, and it conceptualizes breastfeeding as systemic, dynamic, and a procedural aspects. So we need to know that as professionals, we need to develop such kind of models. We need to develop such kind of a solid base where um, the support system or the role of support system would be wanted to and would be encouraged and would be a setting stone for establishing a positive relationship between the family members. There is a lot been spoken about why you need to support the women who are breastfeeding. There are certain powers which are listed down in view of breastfeeding support. There are policies, there is community participation, there are organizational rules, and definitely all this would help the mother to have a bond between the mother, the bond would increase between the mother and the baby. So that is why it is said you did not fail to breastfeed. No one fails to breastfeed. They are failed by a system that it helps or it fails to support them during breastfeeding when they cannot. So with this, I would conclude and say that breastfeeding is not limited only to the mother and the baby, but it equally includes the partner, the father, and the extended family members who she is with. So if you have any doubts or any questions, we can have it later.
Now, I would like to invite Mrs. Sharmila Kulal ma'am. Ma'am has qualified Masters in Nursing and pursuing PhD. Ma'am has 30 years of teaching experience and 1 year of clinical experience. She is currently working as a tutor in Bharati Vidyapeeth deemed to be University College of Nursing Pune. Ma'am has guide for the research, diploma and the PG. She is a member of TNAI, alumni of BVCon, organized a various conference, workshop, various research publications in national, international journal. Ma'am is going to speak on empowering breastfeeding parents' perspective, reflective thinking on support system. Over to you, ma'am.
Good afternoon, everyone. Today's my topic is regarding empowering breastfeeding, reflective thinking on parents. First of all, empowering breastfeeding means mothers adequate knowledge and skills for breastfeeding and believe in the value of breastfeeding. The cornerstone of newborns nutrition is breastfeeding due to its well-known benefits for mothers, children, and society in the long term and short term. The family members not only affect her choice to start and endure breastfeeding, but also significantly responsible the early postnatal period cessation of appropriate breastfeeding. I have taken one case scenario. I have hide the mother and father's name. The case scenario is regarding the reflective thinking on parents. The name of the mother, Mrs. XYZ, she is 29 years old. The name of the father, Mr. ABC, and age is 31 years old. Age of the baby is 4 months. Interview taken from the both the parents on views regarding breastfeeding. Mother says, I know the importance of the breastfeeding. I got the information during my antenatal visits. I know the benefits of breastfeeding to my child and for my health also. Also, she has told that after the delivery, I started the breastfeeding within half an hour to 1 hour. My husband is helping me during the care of the newborn, and he is helping me in small, small things, and other family members also taking care of me and my baby. So I'm getting enough time for their taking for the taking care of the baby, and so I'm feeding the baby on time. The weight gain of the baby is appropriate, said by the doctor. So she's happy and satisfied that I am taking good care of the baby. The views of the father are, before the marriage or even after the marriage, I don't know much about the importance of breastfeeding, but during my wife's antenatal checking, the doctors and staff nurses given the information regarding what will all things are important for the baby and mother. I'm helping my wife so that she will get adequate time for the rest and for the breastfeeding at home. And also, I'm learning the burping, how to burp the baby, and he's happy during the caring of the baby. of this is regarding the scenario. A father's knowledge and attitude are fundamental in this regard, as he has the most critical role in helping women with parenting and feeding their babies. Future initiatives should be target new mothers and their spouses to see how they may provide the most beneficial assistance to new mothers. The main focus should be on targeting newly married couples. The father's main responsibility is to become a supporter and enabler of breastfeeding the infant. The father's knowledge of breastfeeding causes him to want to support it, and his encouragement of breastfeeding enhances the mother's confidence to start it. So, the conclusion of the topic. So, it is important to focus on parents so they will get the adequate knowledge about the breastfeeding and their importance. This is regarding my topic. Thank you.
Now, I would like to invite Miss Nikita Jaybhay. She has qualified Masters in Obstetric and Gynecological Nursing. Ma'am is having 1 year of teaching experience. She is a clinical instructor at Bharati Vidyapeeth, deemed to be University College of Nursing, Pune. Ma'am has published research at national level. She is a member of TNAI, alumni of Bharati Vidyapeeth College of Nursing, Pune, organized various workshops and conference. Ma'am is going to speak on empowering breastfeeding parents' perspective, reflective thinking on support system. Over to you, ma'am.
I am going to discuss on empowering breastfeeding, reflective thinking on support system. We will discuss the case scenario: mother which breastfeed to her baby and take care of her baby. The family member like mother, mother-in-law, sister, sister-in-law are all supported in home for breastfeeding. In support system, when I had conversation with postnatal mothers and their family members in society, and I also observe in my day-to-day practice in my workplace at that is Bharati Hospital clinical area. There are so many postnatal mothers and family members with her. Some women with the some women with the mother-in-law and mother also. They take the care her such as care the breast before the feeding and teach help to hold the baby and latch the baby. Her mother supports for uh, her mother's support for the breastfeeding. They know the bond between mother and the baby. It is important, and hence they do help for the skin to skin contact for the baby and mother. They show their love and affection for all action need for breastfeeding. They also sure that mother get adequate diet and proper rest. They know about disadvantages of bottle feeding. At home, many people feel warmth, love and relaxation for feeding and comfortable.
Thank you, Mrs. Pranalini Pardeshi ma'am, for sharing your valuable thoughts on empowering breastfeeding parents' perspective. Thank you, Dr. Supriya Pottal ma'am, for your enlightening speech that was really creative and fantastic. We really enjoyed your session on empowering breastfeeding parents' perspective, role of support system. Thank you, Mrs. Sharmila Kulal ma'am, for sharing your valuable thoughts towards empowering breastfeeding parents' perspective, reflecting thinking on support system. Thank you, Ms. Nikita ma'am, for sharing your ideas on empowering breastfeeding parents' perspective, reflective thinking on support system. Thank you, dear participants, for joining with us for today's session. If you have any queries, kindly put it in the chat box. Thank you once again.